Welcome back to the Primal Professor. Today I want to talk about prediabetes. And let me start off by reading you a statistic. Less than 1/4 of patients who met the criteria for prediabetes received drug or lifestyle modification treatments from their primary care physician. This was according to the University of Florida researchers, who say that findings indicate physicians are missing opportunities for diabetes prevention. I have to be honest, I've experienced the same thing. No one talks about prediabetes. They only talk about you need to lose weight. So are you wondering if you have prediabetes? Well, your body might already be giving you some signs and symptoms that you do have prediabetes. You know what? You don't need a lab to find out. In this video, I'm going to go over the signs and symptoms of prediabetes that you can spot right now. No needles, no labs, good old-fashioned body awareness. And we're going to arm you to go then to your doctor and ask for the right labs if needed. So before we get started on the signs and symptoms, I wanted to look up some of the reasons why physicians are not talking about prediabetes with us. If they're only talking about our weight, they're not giving us the implications of where this can lead, and how they're not talking about how closely linked insulin resistance and diabetes is associated with chronic disease. So here are some of the reasons documented why physicians aren't talking and having these conversations with us, their patients. One, they say it's a lack of urgency. It's seen as a future problem, yet complications like neuropathy can start very early. It's limited provider knowledge. Many physicians don't understand the full risks, diagnosis, and management of prediabetes. They're also unaware of prevention programs. Doctors may not know about lifestyle interventions that work. This channel is about a low carbohydrate lifestyle across that spectrum, and that is one of the ideal ways to prevent, reverse, and even avoid prediabetes. They're also avoiding over-medicalization. Some wait till full-blown diagnosis of diabetes to take any action. They don't want to diagnose someone too soon. And then there's the weak patient-provider dialogue. Time limits and assumptions block critical conversations. We know you're in and you're out in that doctor's visit now. And it's a silent condition, really. There's no obvious symptoms if it's often missed. You could be thin and have prediabetes, and you could be overweight and have prediabetes. Obviously, it happens more often with a person who's showing signs of obesity, but there are skinny fat people too who fall under and are at risk for prediabetes. And right now, the medical there's inconsistent guidance and no clear definition for prediabetes, which I disagree with. I think it's pretty laid out there now, and it creates confusions for doctors and patients. I think that's baloney. That's what I found to be some of the reasons why. So let's get into this. What are we going to do? I'm going to teach you to see the signs in yourself or maybe a loved one, and then we'll talk about what you can do when you do go to the doctors and what tests to ask for. But right now you can tell without labs. Prediabetes means that your blood sugar is not high enough to be diagnosed with full-blown diabetes. It's what I like to refer to as the warning zone. It's the bridge between normal blood sugar and being diagnosed with type 2 diabetes. 1 in 3 adults in the US has prediabetes, and they are unaware of it. So that's why I'm making this video today. Good news is that your body gives clues long before it shows up on lab tests. The problem is doctors are only testing fasting glucose. They are missing the boat. If they would test for fasting insulin, we could pick up prediabetes way before even the clues start. By recognizing early warning signs, you'll be able to make lifestyle changes to prevent or delay the onset of prediabetes and type 2 diabetes. Watch now and take the first steps to a healthier you. Always tired? That energy roller coaster is a classic sign of blood sugar instability. This one I really can relate to. Hunger after eating. If you're starving an hour or two after you just finished dinner or a full meal, your insulin may be spiking and then crashing, and that leads to rebound hunger. I really experienced this. For years, this was my issue. 3, you have extra weight that around the middle, it just won't budge. You might lose some weight other places, but that belly's still there. That's also called visceral fat, the fat that's underneath the muscle and around your organs. That causes a tremendous amount of inflammation in your body, and it promotes insulin resistance. Number 4, skin tags. Little fleshy bumps around your neck, armpits, and groin. These skin tags are often driven by hyperinsulinemia. So when your blood sugar levels are too high, okay? As your insulin resistance improves, these skin tags will actually go away, and then you'll know you're on the right track. A little bit more about insulin. Insulin's nickname is the hunger hormone, okay? And there are certain times that we become a little insulin resistant in life. So picture, I remember my son going through puberty. He grew 4 inches in like 3 months. Boy, you can bet that his insulin levels were higher, because insulin is to promote growth. That's really what it's there for. It's the hunger hormone, so it's telling you to grow. It's telling things in your body to grow. And when you're 13 or 14 years old, young male, and you're having a growth spurt, that's appropriate. Another example would be when a woman becomes pregnant. In order to support the growth of that fetus, her uterus gets much larger, she has to grow a placenta, and she's forming a new life. We become naturally more insulin resistant during pregnancy. Now, if you had normal metabolic function at the time before you got pregnant, then you're going to be fine. But if you had insulin resistance, then you're probably going to have gestational diabetes. That's why it's really important for people who are thinking about getting pregnant to get in the best metabolic health prior to getting pregnant. An abnormal outcome of insulin resistance are that some cancers thrive on glucose. Breast cancer, colorectal, liver, pancreatic, lung, and prostate cancers. My husband had prostate cancer at 49. He had already had skin tags and other signs of insulin resistance. And he had to have his prostate removed. That's how high his PSA levels are. So all of those cancers thrive when it's like you're a fertilized soil when your insulin is high for abnormal growth, whether it's skin tag or cancers. Number 5 is dark velvety patches of skin, and that's called acanthosis nigricans. These are found around the neck area and in the armpit area, and it is a classic sign of excess insulin in the blood. Excess insulin in the blood, as goes hand in hand with prediabetes. Number 6, frequent urination and excessive thirst. The medical terms for those two conditions are called polyuria, excessive urination, and polydipsia, excessive thirst. Now, it doesn't take a big fluctuation in your blood sugar. So when it's slightly elevated, what the kidneys try to do, again, the body has mechanisms to control that amount of blood sugar, and when they start to fail, then that's when you start creeping above the level of normal glucose. But what happens is the kidneys, just that little bit of shift over 100 100 milligrams per deciliter in US terms. The other parts of the world, 3.9 to 5.6 millimoles outside the US. You can just go up a little bit higher than normal, and then the kidneys are going to kick into action, and what they're going to try to do is eliminate the glucose through your urine. And to do that, they're going to pull a lot of fluid out of your body to carry that glucose out. And so you'll get dehydrated, and you'll get a thirst that doesn't seem like you can quench it. So I remember my aunt, when she was first diagnosed, she came in to see my mom, and she walked in from the front door right to the kitchen sink and got a glass and downed 3 full glasses of water. She just couldn't. It's like not a thirst you can really quench. Okay, so let's just review normal blood sugars here. I'll put them up on the screen. Okay, so if you're over 100, if you're 70 to 100 in US units, milligrams per deciliter, you're normal. From 100 to 125, you are pre-diabetic, and over 125, you have type 2 diabetes. I put the corresponding outside US values up on the screen as well. Number 7, brain fog. We've talked about this in other videos, but what happens is when you were experiencing that fatigue and you had that blood sugar instability, your whole body's fatigued, but it's happening to your brain as well. You might have trouble focusing, you might be forgetful. With glucose highs and lows, your brain's fuel supply is affected as well. When you go on a low carbohydrate diet or a ketogenic diet and you're producing ketones, you have an alternative fuel which the brain loves. Number 8, blurry vision that comes and goes. Okay, so glucose can temporarily swell the lens in your eye, making your vision blurry. But blurry vision, whether you wear glasses or not, it could be a sign that you have prediabetes. Number 9, slow wound healing and frequent infections. Let me tell you, we all know, most of us I think know that with diabetes, wound healing could really be a problem. But it starts to delay even when you're in that pre-diabetes phase, and you'll find you get more sick, more infections more frequently. When you have high glucose, it impairs immune function and tissue repair. It slows it down at that pre-diabetic level. Okay, so if you're just noticing something's taking a little bit longer, keep that in the back of your head. I have to tell you, in my career, I've treated many diabetics, and when I was in inpatient rehab, I worked a lot. I loved working with patients post amputation, and so when someone needs to lose a limb, the wound healing is pretty critical. Now, I'll tell you, I've had patients that were followed their insulin protocols and their weight management, and their diet, and then I had others who did not. And the outcomes were much better when people controlled their blood sugar. When they didn't, oftentimes I would see people getting revisions, that they had the initial amputation and then that wasn't healing well and they had to go up higher. So the whole point of this video is really to, while you're in this prediabetes phase, this is the easiest time to make changes and reverse it. You can do it, and I want everybody to hear that. You can be diagnosed with type 2 diabetes and reverse it. We're working on my husband right now with that. He's my worst client, I'll just tell you that. He's not going to listen to me. You know how that goes. But with prediabetes, it's really, if you're seeing slow wound healing, it's time to make changes. Number 10, this is really an important one too. Tingling and numbness in the hands and feet. Now there's lots of reasons why you can have numbness and tingling in the hands and feet. We know, you probably heard of carpal tunnel, and that's inflammation in the wrist area that causes compression on the tendons and the nerve that runs through a tunnel there. Okay, so that's a different reason. That's not nothing. That doesn't have anything to do with diabetes. However, with excess glucose in the bloodstream, like it's having those negative effects on all the other tissues, that Maillard effect, it affects our small nerves and the nerves of the hands and feet first. So early nerve damage or neuropathy, that's the medical term, can start long before you have full-blown diabetes. So if you start getting those symptoms, you need to go to the doctors right away, because it could be something else or it could just be prediabetes. But the good news is that's part of the peripheral nervous system, and the peripheral nerves can regenerate. Okay, there's a covering on the outside of those nerves called the myelin sheath. It's made with fat, and that conducts the impulses. And so that's why a ketogenic diet or low-carb diets are very helpful when somebody has that. People talk about anecdotally that their signs of neuropathy are much, much better. Okay, so if that's something you want to find out, if you have numbness and tingling, you need to go to the doctor and get a metabolic panel and maybe the test to measure nerve function would be an EMG and a nerve conduction study you might need. But if you've ever experienced, in that slide where we talked about the fatigue and the rebound hunger, what's happening there is you're getting that glucose spike. Nothing happens on the first round of insulin, then you're getting the second round of insulin. And one of my clients said to me, oh, I had low blood sugar today, it was 80. Well, 80 is a normal blood sugar, 70 is a normal blood sugar. But when you're coming from 160 down to 80 really fast, you'll get the same signs of low blood sugar. A friend of the family said to me, my husband's friend, he said, can I have some soda? I need some sugar. He goes, I have a low blood sugar problems. I don't have high blood sugar problems. And my husband looked at me like, don't go there, Rose. And really what he's experiencing is the double load of insulin and then bottoming out. So that person is exhibiting classic signs of prediabetes. But when you feel that way, you feel anxious, you feel nervous, you can feel emotional during that, and above all else, you can feel real cranky, okay? So, are you at risk? These signs are important, but there are a few silent red flags that I want to bring up here that you may not realize are connected to blood sugar. The first one is hypertension. Elevated insulin causes sodium retention. Okay, that insulin tells the kidneys to hold on the sodium, and then that sodium and then that insulin also tells the vessels to start constricting, which raises blood pressure. Okay, and another red flag is if you have PCOS, polycystic ovarian syndrome. And you don't have to be overweight to have this, and you may not even realize it, but in women with PCOS, it's linked to insulin resistance even before weight gain, and it sets in. And then they have difficulty conceiving. And they treat it with metformin, but I say, hey, why not try through a low-carb lifestyle first? Okay? So what can we do about it? Starting today, I would start tracking your carbs. Get a macro app like Carb Manager, MyFitnessPal, Chronometer, whatever one. I particularly use Carb Manager. I find it to be pretty friendly and easy to use. And find out how many carbs you're eating right now. That's really important. Are you starting at 300 a day, or are you already at 100 grams a day? So that makes a big difference of how many carbs you're starting at. And then either way, you want to bring them down slowly. I'll link in this video the low carb spectrum so you can figure out where you should start. Then a very simple thing you can do after you eat any meal. Try to stick to 3 meals a day. Quit the snacking in between if you can. If you eat good protein, good fats to the point of satiety, and have like veggies, green veggies, the cruciferous veggies like broccoli, cauliflower. You can have asparagus, greens. If you can eat those and not eat in between, and after each meal, just go for literally a 10 or 15 minute walk. Not out there power walking, just get up and move. The other thing you can do is replace sugar sweetened drinks. These are often sweetened with high fructose corn syrup, which is a direct cause of non-alcoholic fatty liver disease. It's just as bad as alcohol for the liver, and also really can flare up gout. So if you can replace these sweetened drinks with water, tea, black coffee, or you can have coffee with heavy cream in it, or half and half, but just get rid of the sugar. And then eat more protein, fiber, and healthy fats. We kind of mentioned that already. They will keep you satiated. And eat the fat that comes with the meat. Nature intended that. God intended that. When we eat the fat that comes with the meat, and believe me, this was one of the hardest things I had to get over. It's there, it's perfect in nature, because that fat helps you absorb the amino acids in the meat. Now you think you might have it. You can have one of these symptoms and you could be on your way to prediabetes, depending on how old you are and some other factors. But if you have several of them, now you need to go to the doctor and say, listen, I think I have prediabetes. I would like a full metabolic workup, and I would like you to include a fasting insulin test. Okay. Now, if you just have 1 or 2 of these, you recognize them, you can go ahead. I would say even if you have a bunch of them, start making these changes now. But I would recommend you also go to the doctor, because what's really nice about this is if you get these baseline values, fasting glucose, fasting insulin, triglycerides, all of them, your cholesterol and all that, and then you go on the diet, and then you have them you repeat these studies, and you see all the positive changes, right? What that does is shows your doctor that the ketogenic or low carb lifestyle really can reverse prediabetes or type 2 diabetes. We are educating them. They are so busy, they're seeing patient after patient after patient. And the science is there now, but the medical system hasn't caught up with low carb. I hope I gave you information to make you think that, maybe I do have prediabetes. And there's plenty of information on this channel that will help you with a low carb diet. But if there's something that you're not seeing in my playlist, shoot me a message down in the comments and I'll try to make a video. I'm making them as quickly as I can, but if there's something specific you want to know, I would be happy to create that video, put that in front of up in the first queue. But start making changes now. You can remember, disease doesn't happen to us. It happens because of our habits. And unless we make the change, then the disease will progress. We can halt it in its tracks. I know you can do it. So I hope this made you think. I hope I'm providing you some resources. If this was helpful, please consider hitting the like button and subscribe for more information about how to reverse all these chronic conditions. And remember, stay healthy, stay in ketosis, and I'll thank you for being here. I'll see you in the next video.